And you should, from your history and your exam, you should know 85% of what you need to know with no test whatsoever on most patients. Again, we're talking about averages over all patients that you see. I would have a personal goal of like clinching the diagnosis 85% of the time with no test whatsoever. The tests are made to help confirm what I'm already suspicious of. I'm not using the test to bring about brand new information that I didn't even think of.
Right.
So that can cut down a lot. Your documentation, the things we talked about earlier, and having a template that has everything out, and then you just put in a lot of detail the pertinent positives and negatives. Documents a good chart that flows very well, that communicates very well, and it takes way less time than just kind of clicking all over the place. And then at the end, you're like, well, I don't even know what this patient is here for.
Right. Yeah. And I would add, from my limited experience compared to yours, don't stack orders if you can really avoid it, because that really bogs down the department, especially for nursing.
That's a really good
stacking
point.
Orders is like you put in a couple things because maybe you sat down real quick and you just, okay, they need this. And then you go back and you're doing their chart and you're like, oh, I want to add this. And then I want to add that. And it really slows down the whole department when we do that.
Yeah, sometimes that's inevitable. But you should, again, let's just use the 85% rule. 85% of the time, you should not order any new orders whatsoever after your initial order set. Sometimes you need to add something because there was a surprise, or we're all human, right? We forget to order a troponin on a chest pain. Like, that's pretty important. But you shouldn't piecemeal things. You shouldn't piecemeal treatments. You shouldn't piecemeal tests, because that's just your efficiency, but you're also really affecting the nurse's efficiency too. Another thing is doing the same thing every time in the same way.